afternoon, good evening. Thank you so much for joining us for the MPOX special briefing from AfricaCDC. My name is Margaret Edwin, the Director of Communications. I will be moderating this session. We're starting off with a situational analysis from the Director General of AfricaCDC, and we have special experts as well, part of stakeholders for AfricaCDCs that are joining this session. I will now pass it on to the DG to introduce the other experts on this call. Over to you, DG.
Good morning, good afternoon, good evening to all of us. So happy to see all of you today. As we said, we committed every week to have our press conference to update on the MPOX situation in Africa. Today, we are taking this call from DRC, especially from a well-known institute called INRB in French, Institut National de Recherche Biomédicale. That is the main institute, the main institution for research and development in DRC. And we are with Professor Muyembe, a person known everywhere in the world, and even we received an award from the WHO Director General during the last year WHA. And Professor Muyembe is the person who's conducting a number of studies, starting with Ebola and all diseases, and now with MPOX. We feel humbled to be with him today. He will share with us the last update from the studies he conducted, especially on the Tecovirimat, this medicine that was said can cure MPOX. And he will also update us on the next what could be next in terms of research and development. Today, let us start with a kind of update on number of cases if we compare from last week and this week. As you can see in your screen, we have the report from the 13th of August, and we have the report from the 20th of August. You'll see from the first week to date, we have an increase of cases from 17,505 cases to 18,910 cases. It means there is almost an increase of 1,400 cases in 1 week. And we have also increased in terms of death, even if it's not well reflected here, but we have 24 deaths in addition if we compare with the previous week. And an alert is coming from Burundi, from DRC, and from CAR, where we see an increase in terms of deaths and cases. This one is showing us that even if we don't see more other countries affected, we are still in the same number of countries, the same 4 regions, but we need to consider MPOX after our declaration of public health emergency of continental security. We need to consider MPOX as growing and spreading in not only Africa, but other continents. I think you saw also the Director General of WHO declaring MPOX as the public health emergency of international concern. With that, we wanted also to update you on some what we did during the week and what could be the way to move forward. During the week, you saw the statement from President Ramaphosa. President Ramaphosa is our champion on pandemic preparedness, prevention, and response. And as champion, the African Union champion, he decided to release a statement to clearly request solidarity in Africa, but also with our partners. And
Donc ici en Afrique et avec nos partenaires.
He requested also to work on a more coordinated way to ensure that when Africa is responding to this outbreak, all partners are coming together under the leadership of AfricaCDC, as it's stated in the AfricaCDC statute approved by head of state. But he clearly said we need to work together. We need to work together with all partners. We are so glad that WHO, and especially my sister, Dr. Mweti, who's leading WHO Afro, also WHO EMRO and UNICEF, Western Central African region and UNICEF Eastern and Southern African region, we are coming together to have one team, one incident management team. And that one will be the first time in Africa to respond to an outbreak by working together like that. We also saw a clear request from President Ramaphosa about what we call the medical countermeasures, like vaccines, like diagnostics, like therapeutics that can be available. We saw clearly the president requesting for other partners, international partners, to support Africa for that. I want also to raise this statement that we saw from Bavaria Nordic. As you know, Bavaria Nordic is manufacturing a vaccine for MPOX. Last week, I didn't want to mention because we're finalizing the discussions, but I told you, AfricaCDC, we have a clear plan to procure and make available 10 million doses for our Africans. And with this statement that came from Bavaria Nordic, you saw clearly that Bavaria Nordic is working with AfricaCDC to ensure that Africans can have access to vaccine. And the 10 million doses we are talking is not a dream. We have a clear plan by end of 2025 to have these 10 million doses in Africa. And we thank also European Union through this emergency humanitarian leg era for partnering with AfricaCDC to put a mechanism in place for the 215,000 doses that were procured. Today, we are working with all member states, African member states, to see how we can strengthen the supply chain and how we can also strengthen the communication component to ensure a smooth introduction of this vaccine in Africa. The most important one for me as Director General AfricaCDC is to say it every day, we need local manufacturing. And I want to recognize that and to thank Bavaria Nordic for accepting to do the tech transfer in Africa for Africa to manufacture the vaccine that will lower the price and it will not compromise on the quality of the vaccine. The discussions already started between AfricaCDC team and the Bavaria Nordic team and some African manufacturers. I think in the coming weeks, I will update you on this tech transfer of technology to African manufacturers to start to manufacture the MPOX vaccine. This one is giving us hope. It's giving us hope mostly also because we have strong engagement of our leaders. You saw the meeting we had with the president of Mauritania, who's also leading African Union, is also the chair of the Committee of Head of State of AfricaCDC. Clearly, President Ghazouani said, we support what AfricaCDC is doing to safeguard the well-being of African and the continent. By safeguarding the well-being of Africans, we are also safeguarding the well-being of the world. Because if today we stop this outbreak in Africa, we are also saving life in other continents. We also saw this week the meeting that we had on Friday with President João Lourenço from Angola, on the way in his capacity also as first Vice President of African Union, on the way he's committing himself, he's committing his country, he's committing the continent to fight the MPOX. Having this kind of commitment is making us proud, is making us motivated to continue. But in addition to that, as you know, President Lourenço is facilitating the dialogue between DRC and Rwanda for the ceasefire. You will see in the information that I'm sharing with you, this MPOX now is becoming a major issue in the eastern part of DRC, especially in the South Kivu. And having this ceasefire in place will help the government, will help partners and AfricaCDC to support the response in the eastern part. We thank President Lourenço for that. You saw after the meeting with President Lourenço on Friday, we were on Saturday in Harare to meet our leaders from Southern African Development Communities, SADC. All of them, they applaud the action from AfricaCDC. All of them, they applaud the proactivity from AfricaCDC. All of them, they are asking AfricaCDC to continue to work with other partners and to make sure that we have appropriate tools to respond to this outbreak. But they commit themselves also, and this is the most important one, to provide appropriate support, including financial support, to respond to this outbreak. We'll talk about the next step, the meeting that we will have with head of state to see how we can come together and to fight this outbreak. We left Harare on Saturday. We landed in Brazzaville on Sunday. And we had engagement with the Prime Minister in Congo-Brazza, with the Minister of Health, and with some partners there to see how this country, also affected by MPOX, can strongly respond. And as you know, Congo-Brazza reported the last case in April 2024. That one can be good news, but can also be bad news. It can be good news if we can ensure that the surveillance is strong, we are not missing any case. And that one can confirm that we stopped transmission of the disease. But it can be also bad news if the surveillance is not strong enough. It means we are not notifying all cases that are at community level, and that one will lead for an increase of cases very soon. And on Monday, we came in DRC, and we want to thank the leadership of DRC for facilitating everything. We had yesterday, Monday, a meeting with the minister and all partners to discuss the response. Yes, we can see there is improvement. Yes, we can see that currently the minister is taking the lead. Every Monday, he has a meeting briefing him on where we are with the MPOX. Yes, there is a progress because there is a draft of a response plan. Yes, there is a progress because all partners, they are committing to support. Yes, let us recognize there are still some challenges And we are working on these challenges. And these challenges, it's about the testing rate that is still low. It's about putting in place a strong community-based surveillance system. It's about putting in place a strong supply chain management that can accommodate the vaccine that we are bringing in the next few days. It's also a challenge on how to communicate on a more appropriate way to avoid stigma and to avoid to provide messages that are not appropriate in the context of MPOX. Now, saying that, because we are led by a continental approach, let us also recognize that at a regional level, because when we talk about Africa, we are not talking about a region, we are talking about the continent. At a regional level, there are some ongoing consultations. We want to thank the Central African region under the leadership of ICAS, the Economic Community of Central African Countries. They organized a meeting with all countries, member states from Central Africa, to start to design the regional response plan. We congratulate them because that one will be integrated in the continental response plan that all partners are putting together. In SADC, we got also a clear guidance from head of state for a ministerial SADC meeting. As you know, now it's Zimbabwe leading, and I had a nice chat with my brother who's minister of Zimbabwe. He will call for a meeting very soon of all ministers in SADC to see how they can also design a regional plan. We are also working with Eastern African community, with Western African community to see how, not only at country level, but at regional level, we can continue to work and to develop plans. The spirit that we started with the pandemic fund to have a regional approach, we are implementing that. Let me be clear on that. The response we are talking about is led at national level by the minister, at regional level by the regional economic communities, and at continental level by AfricaCDC, working with all partners. This is the coordination we are talking about. This is what will make us strong enough. And this is what will make Africa winning. I will stop here, hand over to Professor Muyembe, because all of us, we got some questions about availability of medicines against MPOX. We are expecting that the Tecovirimat could be the medicine that we can use to fight MPOX. But Professor Muyembe, with his team and many partners, they conducted a study that came with some conclusions. And you saw it was made public. But today, because we have opportunity to have Professor Muyembe, I will hand over to Professor Muyembe to tell us how they conducted the study and what is the outcome and what can be the future of R&D in DRC regarding MPOX. Over to you, Professor.
Okay, thank you very much, DG. Maybe I can speak in French? Yeah. Okay, okay, thank you. Bon, bon après-midi ou bonne journée, je ne sais pas comment il faut dire. Voilà, j'ai été invité par Son Excellence pour parler brièvement de l'issue de notre étude, un essai clinique randomisé à double aveugle que nous avons mené sur à Kolé, dans le Sankourou, et à Tunda, dans la province de Maniema. Les conditions de travail sur le terrain, c'était vraiment difficile, mais malgré cela, nous avons quand même abouti à des résultats. Et nous voudrions avant tout remercier à l'Organisation mondiale de la santé qui a chapeauté l'étude, les NIH aux États-Unis qui a financé l'étude, les malades de Kolé et de Tunda qui ont accepté de prendre part donc à cette étude et surtout à nos vaillants collaborateurs qui, malgré les circonstances difficiles, ont travaillé durement et aujourd'hui, nous sommes fiers d'annoncer ce que nous avons fait. En fait, la molécule tecovirimat a été utilisée de façon empirique lors de l'épidémie multi-pays de MPOX qui est apparu donc en 2022. Donc, l'utilisation de ces produits avec la vaccination, nous pensons que c'est cela qui a fait que l'épidémie de l'Europe et des États-Unis a été rapidement contrôlée. Mais aux États-Unis et en Europe, ils ont voulu aussi faire un essai clinique pour vraiment prouver l'efficacité et l'innocuité de ces produits. Malheureusement, comme ils n'avaient plus de cas, donc ils n'ont pas pu aboutir à des résultats exploitables. Nous avons eu la chance, malheureusement, je veux dire la chance, aussi c'est malheureusement, le nombre de cas a continué chez nous en RDC et nous sommes donc arrivés à avoir des conclusions qui, malheureusement, sont, à mon point de vue, décevantes. En effet, nous avons prouvé que tecovirimat n'est pas efficace. Le temps de résolution des lésions, tant chez les malades traités avec tecovirimat que chez les malades qui ont reçu le placebo, ce temps-là n'est pas différent. Ce temps n'est pas différent. Et donc, nous avons conclu que tecovirimat n'est pas efficace pour diminuer le temps de résolution, n'est-ce pas, des lésions. Également, quand nous comparons la mortalité chez les malades traités et chez les malades non traités, cette différence n'est pas significative non plus. Mais l'étude nous a renseigné, l'étude nous a montré que si les malades sont pris en charge correctement avec un schéma thérapeutique standard correct, donc en traitant l'hydratation, en traitant la malnutrition, en traitant les surinfections bactériennes, on réduit le taux de mortalité à 1,7% au lieu de 3 à 4%. Voilà, ces résultats certainement sont décourageants, mais ça nous donne quand même de l'espoir. Nous avons pensé, est-ce que si on augmentait la dose, puisque le produit n'est pas dangereux, Donc, l'étude a montré aussi l'innocuité, n'est-ce pas, de ces produits. Et si on augmentait un peu la dose, est-ce que nous ne pouvons pas avoir un effet peut-être plus favorable? Ça, nous sommes en train donc de voir si on peut faire une petite étude dans ce sens-là. Alors, l'espoir maintenant donc réside dans d'autres antiviraux que peut-être je ne connais pas encore, et surtout dans les vaccins. Donc, pour le moment, nous sommes en train de faire un protocole avec NIH pour 3 vaccins, les Genus, les LC16M8, les japonais, et un vaccin à messager RNA de BioNTech. En effet, nous devons absolument faire une étude randomisée sur l'efficacité de ces vaccins, parce que jusqu'à présent, je crois qu'on n'a pas encore vraiment une étude sérieuse qui démontre l'efficacité de ces 3 vaccins. Et voilà là où nous en sommes, mais retenons bien que des soins standards bien organisés peuvent donc réduire le taux de mortalité des malades atteints de MPOX, et un bon message, donc une bonne communication avec la communauté peut également rompre la chaîne de transmission et donner une éducation aux enfants et aux chasseurs de s'abstenir de viande de brousse trouvée ou des animaux trouvés morts, n'est-ce pas, dans la forêt. Ça, c'est le premier volet. Et le deuxième volet, c'est la transmission de personne à personne. Ça aussi, nous avons l'expérience des épidémies passées. Ebola nous a appris que la maladie se transmet facilement de personne en personne en touchant les liquides, les fluides du corps, ainsi de suite. Et la COVID, tout dernièrement, nous a aussi appris beaucoup, et surtout l'hygiène des mains. Mais malheureusement, on a vite oublié tout cela. Mais il est grand temps maintenant que nous remettions tout ça en place. Alors, en ce qui concerne la transmission sexuelle, nous avons également oublié tout ce que le VIH-Sida nous a appris, le port de condoms et d'autres précautions qu'il faut prendre. Je pense que pour nous aussi, ça c'est une leçon qu'il faut tirer pour remettre tout ça en place et ne pas perdre de mémoire de tout ce que nous avons fait, ce qui nous a donné la victoire sur toutes ces maladies. C'était des mesures de santé publique simples qu'on applique correctement et on sauve des vies. Voilà, merci beaucoup, DG, de m'avoir associé à cette conférence de presse. Merci.
Remercions professeur Muyembe et Margaret, back to you for questions and from our journalists.
Thank you, DG. We'll now move to the floor to take questions. Britton, I can see your hand. You have the floor.
Sorry, I just at the beginning I cannot hear it clearly. So I will solve the problem right now. I got no question right now. Thank you.
Thank you. Lizzie, I can see your hand. You have the floor.
Great, thank you. Thank you, DG, for the updates. Mine is usually just taking you back a bit. I have 3 questions. One, last press briefing, I know I asked directly about the RCCE. I still haven't gotten any feedback if the risk communication and community engagement document is already out, and it's still being, and it's already is being utilized by the national, regional, and the continental level by AfricaCDC. My concern literally is the amount of, how do I put it? Fear that we're instilling in Africans. We are giving updates of the cases confirmed, the number of deaths, but I do not see the ABCs of MPOX being really emphasized on. We just know the last speaker talked about forgetting the ABCs of HIV, like putting on condoms, having safe sex. And there's also ABCs of MPOX, like, avoiding dead animals from the forest. We have hand washing, and we saw hand washing being a key priority during COVID-19. So I'm just worried, and I would like to know, how is AfricaCDC or the regional blocks using organizations like INRB, which is a civil society organization that is a consortium of other CSOs and community groups, and how are you tapping into that kind of network just to break down MPOX and avoid the threatening sort of a thing that appears now? It's more of threats around MPOX than, keep calm and do the ABCs, and prevention is better. So the other question, which I know you've gotten a lot, is around vaccines, and I needed to know, do we have a country that has stocked enough that if there's a case of an emergency in another country, we can just literally move vaccines from one African country to the other? And the third question is a bit of a concern from a communications expert. Mine is around a direct question to you, DG. I know it's a new office still, etc., but did we drop the ball with MPOX? It's always been there. Did we drop the ball? And that raises the question and concern around other diseases like Ebola, etc. Are we not having enough strategies in place to mitigate such kind of diseases? Because if we've been fighting MPOX for quite some time, so then that means somebody's sleeping or somebody just literally dropped the ball, and I'm more worried about the other diseases. So those will be the 3 questions for you, DG. Thank you.
One more, let's take one more question. Janice, you can come in.
Hi, I had 4 questions, but they're all related to vaccines, and I'll try and keep them very short. My first one was simply when you expect the first shipments to arrive of vaccines, just to clarify whether these are all expected to be donations or if they've been paid for, and if they've been paid for by whom. And then the third one was just if you could give us some sort of timeline on when you expect MPOX vaccines to be made on the continent. You spoke about the talks with Bavarian Nordic. And the fourth one is just to clarify a little bit on what you were talking about in terms of coordination. My sense is that some of the companies are speaking directly with governments, which is fine, but in terms of getting a real grip on where vaccines are going, if they're going to places where they're needed most, if that's going to be something that you try and do away with, and sort of put AfricaCDC at the center of directing resources and directing the whole rollouts.
Thank you. Over to you, DG.
Yes, let me say I had some issues to follow questions because I think my colleagues are working to increase the volume. But let me respond based on what I got. If it's not exactly what you wanted, you can come back. On the RCC, let us agree with you that we really need to reinforce this component. Yesterday, during the meeting with the DRC team, ministers and partners, we saw that sexual workers, they start to claim to change their status, even to say they are unemployed or they are student because of the stigma. You know, today we must be clear that to get MPOX is not just only a sexual transmission. It's any contact, as the Prof Muyembe said, any contact with someone who is infected can also lead for a person to get the disease. And this is a message that is critical now. Otherwise, we are creating fear, we are creating stigma. As you know, in the past, in 2022, when we had MPOX in another continent, people were talking about MPOX as a disease for gay people. But this is not true today. Today, anyone can get MPOX, and this is the message. If you are exposed, you can get it. And this message, we need to make sure that our population, they are getting it, and we need to use CSOs. We need to involve youth organizations because they know how to transmit appropriate message using some social networks or using the mobile phone and other innovative way. And we also agree with you. We learned from DRC. Professor Muyembe will tell you he had to fight, he's a pioneer of Ebola. He's someone who supported DRC and other countries to stop also COVID outbreak. Today, we are talking about MPOX, but we need to learn from Ebola and COVID. We need to use MPOX to start to build the system. We don't want to see funding coming for MPOX, not really supporting what can help us to address other diseases. Yesterday, I was talking to the minister of DRC. He was telling me about his vision in terms of community health focus, how he believes that by empowering community health focus, giving a digital tool to community health focus, helping them to be connected even to the data management system of the country will help to also fight other diseases, because MPOX is not the only disease that we have. We have other diseases, but we need just to use this as a Professor said, opportunity to, because we are raising a lot of attention, we are raising a lot of funding, we can use that to build the system to fight other diseases. Regarding the vaccine issue, we are clear on that. Without local manufacturing in Africa, we are exposed, and we cannot continue like that. We are also clear that we need to play solidarity. In 2022, this vaccine was manufactured, and we didn't get this vaccine. Professor is right to say, we didn't conduct serious studies in Africa about these vaccines. Yes, these vaccines gave very good results, supported to stop the outbreak in Europe and in the US. But we also need, while we are trusting this data, while we are trusting this evidence, but we need also to conduct appropriate studies in our context to know maybe that one can help us to readjust even doses, or I don't know, other studies that we can conduct for appropriate vaccines. As he said, we have also BioNTech. They are conducting clinical trial phase 2 and phase 3 of the mRNA vaccine related to MPOX. And we will see how everything will be conducted and what could be the result, because we are clear on that. In Africa, we will have vaccine and medicines that are meeting the quality, the standard of what others they are using in Europe and in the US. There is not an African vaccine and an European vaccine. No, if we have a vaccine in Africa, it must be also used in other continents because it will fit the requirement of standards and quality. In terms of coordination, we don't have choice to work together. We need to work together. We need to make sure that everyone is coming to support the response. But when we talk about coordination, we talk about who is really leading, who is accountable. It's important. At country level, the person who's accountable is the minister. He's accountable vis-a-vis the head of state, is accountable vis-a-vis the continental platform that is AfricaCDC. At continental level, the Director General of AfricaCDC is accountable. He's accountable vis-a-vis all head of state. He's also accountable vis-a-vis WHO HQ, because at global level, WHO is leading, and we are clear on that. I think maybe I didn't get everything regarding coordination, but the few I got, this is what I said. As I was telling you, we have a volume issue. I think it will be resolved, then we can get your questions right. Back to you, Margaret.
Thank you, DG. Let's take the next two questions. Carmen, you can come in.
Thank you so much for giving me the floor, and thank you so much for doing this briefing. This is Carmen Pon at Politico in the United States. I just wanted to get a bit more clarity on the vaccines. I'm just a bit confused. So are you waiting to do the clinical trials that were mentioned to check the efficacy of these vaccines before sort of like start using them in the DRC? I know, I think from the top of my head, the US had 50,000 vaccines that were ready to go to the DRC. But as far as I understand here, they're saying that it's the holdup is sort of like on the DRC side. So I'm trying to understand, what's the plan to bring these vaccines? When are you planning to bring them? Are you planning to use them as part of a clinical trial protocol, or are you planning to use them outside of that? And also the other question, you were talking about the 10 million vaccines that would be available until the end of 2025. That seems like very late. So I was wondering, like, what's the plan, sort of like, what's the immediate plan to use vaccines, if there's one, to respond to the outbreak right now? Because as you were saying, like the number of deaths is increasing and the number of cases is increasing, particularly in the DRC. Thank you so much.
Thank you. Let's check the next one. Nate, you can come in.
Hi, can you hear me?
Yeah, we can hear you.
Hi. I had several questions. One which is similar about vaccine donations. So we know that they're expected to arrive next week. So could you please give us some details about how they will get distributed and who will get a priority, if there's the storage and logistics ready for their arrival and administration? And another question that I have is, what are the latest trends on the spread of MPOX cases and deaths? And are the outbreaks on the continent getting worse or better? And the third question would be, could you tell us if any vaccinations have started already on the continent, and if not, when they will start?
Thank you. Over to you, DG.
Yes, I will talk about vaccines, then I will come back about if outbreak is getting worse or better. About vaccine, I think Professor Muyembe is clear on that. This vaccine in 2022, we had what we call the clade 2 in Europe. This vaccine was used, and based on the evidence that we had, the vaccine supported the response to MPOX in Europe and the US. And We also see some studies saying this vaccine will have the same level of efficacy in the context of clade 1 in Africa. But what we said, okay, because we have some evidence, let us start vaccinate while we are conducting also studies. We are clear on that, and this is what the process said. We are vaccinating, we are also conducting studies. Even in Europe, it was the same, because we don't want to send the wrong information. We don't want people to think that we are using them for a vaccine that we are not sure about the efficacy. No, about the security of this vaccine. No, the vaccine is safe. The vaccine was used. We have data for that, but we say, let us continue to do studies. That studies can help us to confirm or to improve. And as we said, we have in DRC, mostly the clade 1, and we want to see with this clade 1B, is it the same vaccine we need to use? We also clade 1A, you know, these are some information that we'll get from the ongoing study while we are vaccinating. About the vaccine donation, I don't really like the word donation. I think I made it clear. But, you know, I can't stop partners to talk about donation because they are providing funding. But I say we are partnering together to procure this vaccine, even if Africa is contributing with less money, but we are contributing. And an example to that, yesterday, during the meeting with the minister, we clearly said vaccine will be available very soon, maybe end of next week. But for that, we need to make sure that the supply chain management, the logistics are ready. For this reason, we are even providing some funding to the government to ensure that this vaccine will be safely stored and can be safely administered to people who need them. But cold chain or logistics are not the only issue. We are also talking about the communication. We need people to accept vaccine. We don't want to see what happened during COVID. This is why we are starting, and our first colleague who talked about RCC is right, the risk communication and community engagement. We really need to strengthen the communication around this vaccine to make sure that everyone can use the vaccine. The last question about, as you understand, we didn't start vaccination yet. We'll start in a few days if we get, we are sure that everything is in place. End of next week, vaccines will start to arrive in DRC and other countries. Regarding the plan, yes, we are working with all countries. We have a clear plan. We are finalizing the continental plan with WHO, with UNICEF. Let me inform you that even there are colleagues from UNICEF coming to support AfricaCDC at continental level based in DRC for the supply chain management to ensure that we are not losing any dose of this vaccine that is so expensive. Outbreak is getting worse or better? No, I cannot say outbreak is getting better. Everything that we see, we cannot say when you have increase of cases, when you have increase of deaths, you cannot say that the outbreak is getting better. I will say the outbreak is getting better when first the surveillance is reinforced at community level, and we can make sure that we are not missing any case. Second, when the testing is conducted, and we can ensure that we can confirm cases. Even these cases, we can also test HIV and other sexual transmitted infections to ensure that we don't see HIV and other disease increasing. And the third one, I will say that the outbreak is getting better if we see clearly number of cases going down, number of deaths going down, and number of countries affected going down, number of regions affected going down. I think with this data, we'll come to Professor Muyembe, who's member of the ECG. You can remember this epidemiology consultative group that is making technical decisions to guide the DG to say if the outbreak is moving or not. But let me hand over to Professor Muyembe, especially for the clinical trials of while we are vaccinating.
Oui, oui. Bon, ce que nous prévoyons, c'est que la vaccination se fera par... Il y a d'abord une intervention. La vaccination est utilisée comme intervention. Et ça, c'est la priorité. Donc, on vaccine d'abord. Et puis, la recherche, c'est simplement... La recherche accompagne. La recherche accompagne. D'ailleurs, dans notre pays, la recherche est devenue vraiment une composante même de la réponse aux épidémies. Et donc, la réponse de la recherche sera un peu tardive et nous ne pouvons pas attendre les résultats de recherche. Mais comme ce vaccin a été déjà utilisé en Europe et ailleurs, bon, on va aussi utiliser ici en RDC. Et si l'occasion se présente, il y a aussi une recherche clinique qui va accompagner cette intervention. Donc, je suis tout à fait d'accord avec ce que vous avez dit tout à l'heure.
Merci, Prof. Margaret, back to you.
Thank you, DG. We are out of time. However, I will take, I believe, one more question or two. We have, moving on to the Africa CDC media room. We have editors with us that would like to ask questions. I will take one from the media room. Media room, if you can hear me.
No, maybe you can continue. And,
okay.
Yeah.
All right. Okay, let me move on to Gemma. I can see your hand.
Hi, I was wondering if you could give us any information on which clades have been detected in the different African countries.
Sorry.
This is media room.
Could you mute, please? Media room, thank you. Gemma, you can continue.
Can you please give some information on which clades have been detected in the different African countries this year?
Thank you. One more question. Lucy, you have the floor.
My question is, do you partner with other organizations to ensure that the communication part reaches the population? And how does the arrangement look like? Thank you.
Thank you. Over to you, DG.
I'm also here with Dr. Ngashi. I want him not to keep quiet. You can come and provide some answers.
There's a roving mic.
Yes.
Yeah.
Yes, thank you. Thank you very much. Thank you very much, DG. I think on the question of which clades are being reported in Africa, right now we have in Central Africa and East Africa is a clade 1. In West Africa, it's clade 2. In Cameroon, usually we have the combination of clade 1 on the eastern part, and then on the western part, clade 2. And then in the DRC, with the recent mutation, we have clade 1A, which has been there. And then we have clade 1B, which is being reported on the eastern part of the DRC in North Kivu and Sud Kivu. It is also the same 1B that has been reported in Rwanda, in Uganda, in Burundi, and in Kenya. I think those eastern countries, it is the same 1B that is has spilled over. In South Africa, I think the 24 cases of South Africa were clade 2. I think that was reported. Those are the two clades that have been reported in Africa. And then the second question is regarding the communication. What AfricaCDC is doing, I think the support we are providing to the countries. Basically, I think the good news is that many countries like DRC that we are in right now do have extensive experience of these outbreaks and have developed a lot of educational materials. But the point we are working on is first of all to adapt really the communication that is specific to MPOX, which is basically going back to the basics, to start with the basics of hygiene, the basics of avoidance of contact, the basics of early reporting, of cases and isolation where needed in the health facilities, and also the basics around the safe sexual practices. And I think the main strategy is really to start learning from the experience of COVID with the infodemics, trying this time really to mobilize all the different sectors, combining interpersonal communication. That's why the minister was even talking about bring community health workers, also an estimated 40,000 community health workers to do really communication at community level, combined with the media. But this time also, because of the fact that 60% of those that are affected among children, also bring in the component of young people to saturate also the social media, in that space. I think those are the strategies that are being considered. The discussion now with the Minister of Health is to ensure that there is lyric saturation of all the media. Most important, having also the leaders of the country that also stand up front and pass the same message of prevention that is important when access to vaccines is limited at the time. Thanks.
Thank you, Dr. Ngashi. And with that, we have come to the end of the briefing today. I will now pass it on to the DG for his closing remarks.
Thank you, Margaret. I will advocate maybe next time to have 2 hours to give time to our journalists to ask so many questions, because it's critical for them to provide appropriate information to people. And please feel free to email us your questions. We have a team, Dr. Ngashi, Dr. Nikez, and the whole AfricaCDC team, plus our ECG members like Professor Muyembe and partners, WHO, UNICEF, we are together to respond to all questions that you have, because we want to avoid any kind of rumor or infodemics. We are today in DRC because we believe that being on the ground is also helping the country to see differently the way they are responding to this outbreak. It's critical for us as leaders at continental, regional, or global level to come to see what the countries are doing. After DRC, I will visit a number of other countries, sitting with ministers and their teams, supporting them, listening from them, and trying to find some solutions to their problems. Because sometimes to find a solution is just a matter of listening and trying to see together what we can do. This week, we are working for an important meeting that WHO, AfricaCDC, CEPI, NIH are organizing on MPOX research and innovation. This meeting will take place in Addis Ababa very soon because, as Prof. Muyembe said, we need to conduct so many studies. The epidemiology of MPOX is changing. That one is leading for many studies to understand what is going on. Second, because we have so many outbreaks in one. We are talking about clade 1A, clade 1B, clade 2A, clade 2B, maybe to be another clade. No one knows, and Professor is laughing, is right, because we are moving towards a unknown zone. This is why we need to conduct so many studies and to be careful. This important meeting, bringing all key partners working on research and development, plus others, it will help us to understand why the outbreak is spreading like that and what we can do to stop that. We are also working to bring strongly our leaders together. I will give you more information about the summit of head of state we are thinking to organize very soon. That will bring all African head of state together to talk about MPOX. We did it during the cholera outbreak in the SADC region. We organized in January 2024, the summit of SADC leaders. And we think that we can also do that at continental level for this MPOX. The third message we are saying to our partners, please don't punish Africa. We start to hear from here and there that you want to apply travel ban, travel restriction. Please, when you had your outbreak in 2022, we didn't apply travel ban for you, but we applied solidarity. Even if we didn't get any dose from you, we continue to support you. We know some African scientists who flew to some other continent to support the response. Today, we need solidarity. Solidarity means we need you to provide appropriate support in terms of medical countermeasures. We are talking about vaccine. This vaccine is expensive. Our leaders are putting hands together. We need you to come to put hands together with us. We are talking about how to increase the testing rate. The testing rate will increase if you also come to help us, because some countries, they need more PCR, they need more gen experts. All of that will need your support. We are also talking about the knowledge. We are conducting a number of studies. It's really time for us to come together to see how you can share with us your knowledge. I think this is what Africa is asking the world to do. And with my voice, on behalf of our head of state, I clearly request our partners to stop thinking about travel ban against Africans. That one will bring us back on the unfair treatment that we had during the COVID time. And that one will not help the world to move forward. With that, I thank you, and I would be so happy to meet you again next Tuesday to give you the updates of the outbreak and to give you also some actions we are taking. Thank you. Back to you, Margaret.
Thank you, DG. And with that, we've come to the end of the briefing. We will see you next week, and we will respond to the one-on-one questions that we are already receiving. Thank you very much.